PET scans are painless outpatient procedures used to show problems at the cellular level within the body, such as abnormal activity. Doctors can make early diagnosis, monitor and treat conditions like cancer, heart disease, and brain disorders. The images fit into nuclear medicine because the patients are injected with a special dye that has radioactive traces within it. CT scans, its supporting imaging neighbor, uses all X-rays to create its images. Site of injection for PET scans are the patient's vein on the arm or hand, and an hour wait is necessary for absorption of the dye. This produces sharper images. Patients should arrive with an empty stomach about 6 hours prior. When traces are finally injected, they begin to gather where there's higher chemical activity, detecting the presence of disease. The area shows up as bright spots on the scan. Scanning time can last about 45 minutes to 2 hours, very dependent on study. CT scans are quicker and can show signs of disease after spreading. If patient receives contrast dye, they shouldn't consume anything 3 to 4 hours prior. To capture these images, patients must change into a hospital gown, removing all medicine body. Emptying bladder is suggested. It's best to consult with your physician if breastfeeding before this type of procedure to ensure the safety of fetus. If pregnant, a PET scan isn't recommended. In the exam room, the PET scanner has a large flat table with a large ring superior to it. The patient must lay flat, supine on the table. The patient slides up into the ring and asked to remain still the entire time until the test completes. Similar to an MRI, loud annoying sounds are made. After procedure, patient must consume lots of fluids to flush out radioactive tracers and eat as normal. There's no radiation to flush out after a CT scan. However, patients should still drink lots of fluid if given contrast. Radiation risk itself are low for patients who benefit from tests. Abnormal conditions mentioned earlier, such as cancer, brain illnesses, heart disease, are detected early with the help of PET scans. Doctors are able to see if a treatment is working or if treatment needs to be adjusted with cancer patients. They're able to see what stage the cancer is in, if it has returned, or is recovering. Brain disorders like seizures and Alzheimer's are also detectable. Heart disease, which could be scar tissues on the heart, clogged veins or arteries, slow blood flow are noticeable. The above names only a few conditions. The two modalities combined help doctors diagnose more accurately and save lives.